So in today's video, I want to go through diabetes as a whole. I'm probably going to have to do a couple of videos because it is a big topic, or should I say it's a big condition, and there is a lot of information to know. But I think let's know the basics, and once we know the basics, we can then expand our knowledge, okay? And then look into like mechanisms of action and all that fun stuff that comes with it. But for now, let's just break it down and know the, not the bare minimum, but enough to give you an insight of the condition. So diabetes, the two main types of diabetes is type 1 and your type 2, and although they are very similar, there are some differences, okay? And it's important to know what the differences are, because that way you can relay your information onto the patients you are being presented with, and you can then, have an insight of the side effect profile for that patient, or different ways you'll be able to manage them, and the key things to basically watch out for that particular patient. For example, if they're type 1, you'll know they'll be on the insulin, and it's about knowing that one of the risks with insulin is hypoglycemia. So how can we manage that? So you can see from knowing for example, knowing that yes, they're type 1, this is the treatment that is expected for them to be on, and this is the expected side effects that they could then present with, and these are ways where we can almost teach the patient or inform them of ways to manage it. So it's really expanding our knowledge and kind of doing it in like a spider diagram way, where we're brainstorming one thing to the other, and always our main goal is to relay this onto the patient, because what's the point of knowing all of this if we're not relaying that information to that patient to then be able to improve their condition and basically the way they're managing it, okay? Because, not to go off topic, but you are presented with patients, so whether they suffer from gout, whether it's heart failure, whether it's diabetes, it's not telling them, hey, you've just been diagnosed with heart failure. It's about saying, okay, this is the condition. Let's figure out ways where your condition can be managed and how we can prevent long-term complications. And really that is how we should be thinking, okay? So when it comes to diabetes, again, I say it's very crucial to know the two types and what to expect. So even before you've come across that prescription, even before you look at that PMR, it's knowing one little thing and in your brain saying, okay, so I know this patient A, is a type 1 diabetic. Instantly, a gush of information should be going through your head in terms of what is expected. And then once you know all of that, to then look at that patient's medical records, look at their PMRs, look at prescriptions and so forth, and then relay that information, so you're always building, you're always expanding. And that's one way which I think is quite good to manage patients and always give them advice. Okay, so anyways, type 1 and type 2 diabetes. So as I said, very similar, but very different as well. So type 1 diabetes, these are patients whereby they're almost not producing insulin anymore, okay? So there is a lack of insulin. In fact, there's probably no insulin, okay? So they don't have that hormone to control their glucose levels, which then means we need to inject them with insulin. Hence why type 1 diabetics are almost always on that insulin as first-line treatment, because they're lacking that hormone, okay? Now, with type 1 diabetics, they present with symptoms very soon, okay? So it's very quick in terms of picking up their symptoms, and the condition is diagnosed at a young age, okay? So it's childhood. Now, if we flip this, and then if we look at type 2 diabetes, it's almost kind of the opposite. So in terms of presenting with symptoms, this happens on a later stage, so it's not straight away. In terms of diagnosis, again, it's not straight away. It's often during adulthood, Now, even though I say adulthood, diagnosis of children with type 2 diabetes is increasing massively, which is really sad, because it's just sad that this condition is not being prevented, it's not being managed. And as healthcare professionals, it's our duty to try and make that difference, especially in the young generation, to prevent them from getting these long-term conditions. Okay, so we are seeing a rise with children being diagnosed with type 2 diabetes, but in general it's usually when they are during adulthood. Okay, now with type 2 diabetes, it could be that they do have insulin, okay, but they don't have enough of it, okay, and this is called insulin deficiency. Insulin deficiency usually comes after insulin resistance. So with type 2 diabetes, often patients have what we call insulin resistance. So they have the insulin, but the receptors are not responding to it. This is called insulin resistance. And when it's not managed, it then leads to insulin deficiency, whereby the pancreas actually stops producing the optimal amount of insulin. So the level of insulin gradually reduces. So type 2 diabetes, we begin with an insulin resistance, which then can lead to insulin deficiency. Whereas type 1, there is no insulin, okay, which is why we have to inject them with the insulin. So that's basically type 1, type 2. There is a lot of more information, but I'm just giving you like a brief overview. So even though there is a difference between the two, ultimately they are very similar in terms of their sugar levels are very high, and the treatment we are giving them is to manage that and to simply bring the levels down. Sometimes we bring it down too much. For example, when someone is injecting with insulin, one of the main risks is hyperglycemia, which can be very fatal. So it's sometimes reducing it so much that they can go through hypoglycemia. So ultimately that is basically in a nutshell what diabetes is. And in terms of treatment, we're trying to manage the condition, okay? When I say manage the condition, what the principle of the treatment is to alleviate the symptoms, okay? Now, to alleviate the symptoms and to reduce the risk of long-term complications, okay? So it's being presented